Hello, dear students. Welcome back to your channel. Hello, Pharmacology. In this session, let us see what do you understand by general pharmacology. So, the overview of this session will be we will see what is pharmacology, the definition of pharmacology, the example, WHO definition of drug, role of safe use of drugs, and the general concept of pharmacology. So, coming to the word pharmacology. So as you can see here, the word pharmacology has been derived from the words pharmakon, that means drug, logos means science. It is a science which deals with the drug. So basically it is a science which helps in study of drugs. So pharmacology is the science of study of substances that interact with living system through chemical processes, especially by binding to regulatory molecules. Thereby, it can either activate or inhibit the normal body process. So, the definition of pharmacology is it is a science of the study of substances that will interact with living system through an chemical process, especially by binding to regulatory molecules. It can be receptors also, it can be enzymes also. So thereby, by binding to some of the regulatory molecules, it will going to either activate or inhibit the normal body processes. So why we need to know about pharmacology? So pharmacology helps in achieving a beneficial therapeutic effect on some process within the patients. So basically all these drugs are meant to produce some beneficial effect. So therapeutic effect will be beneficial to the patient. Next, coming to the one more definition of pharmacology. So pharmacology is a branch of medicine which has unique combination of several biomedical sciences. So let us see what are those several biomedical sciences. So we have physiology, chemistry, clinical medicine, and biochemistry. So pharmacology is a branch of medicine which has got a unique combinations of several biomedical sciences, which includes physiology, chemistry, clinical medicine, and the biochemistry. So one should remember that pharmacology will form a backbone for rational therapeutics. Whenever you choose a drug, there should be rationale behind choosing that particular drug based on the patient condition. So pharmacology is nothing but it is a basic as well as the applied science. So pharmacology is both basic as well as the applied science. By knowing the basics under pharmacology, you can apply those knowledge into the clinical setting so that it helps in the treatment, diagnosis, as well as prevention of the diseases. So pharmacology deals with the knowledge of drugs, their sources, as well as biochemical and physiological effects, mechanism of action, therapeutic uses of drugs. So one should remember that pharmacology in broad terms, it deals with the knowledge of drugs, their sources, from where they are derived. So what are their biochemical and physiological effects that they will going to mediate, and what is the mechanism of action and the therapeutic uses of the drug. So pharmacology, in simple terms, it is a study which helps to know the effects of drugs and also helps to know how they exert their effect. So, in simple terms, pharmacology studies the effects of drugs and how the drug will exerts their effects on the physiological as well as the pathological conditions. So, let us move on to the examples so that we can understand how pharmacology deals with these all aspects. So when we consider a paracetamol, as you know that paracetamol is a antipyretic, so this will reduce the body temperature if the person has got a fever. So how it will going to inhibit, how it will going to decrease the fever or the body temperature by inhibiting an enzyme that is cyclooxygenase in the CNS, which is required for the prostaglandin synthesis. So these prostaglandin synthesis will be acting as a inflammatory mediators. So thereby inhibiting the cyclooxygenase in the CNS, paracetamol will going to inhibit the synthesis of several inflammatory mediators. One more example is penicillins. So as you know that penicillin is a antimicrobial agent which helps in curing certain bacterial infections. So these penicillins will act by inhibiting or disrupting the synthesis of the bacterial cell walls. So penicillins will helps in curing bacterial infections by inhibiting the cell wall synthesis in the bacteria by inhibiting transpeptidase enzyme, which helps in linking the peptidoglycan chain in the cell wall of the bacteria. So moving on to the next part. So basically we need to know about drug. Why? Pharmacology is a science or the study which deals with the drug. So let us see what is the definition of the drug. So the World Health Organization, that is WHO, in 1966, they have defined the drug as any substance or a product which is used or intended to be used. Please remember, it is any substance or a product which is used or intended to be used to modify or explore the physiological systems or pathological states so that the recipients will be benefited. Either the benefits may be therapeutic benefits or the diagnostic benefits. So this is a very important, you should remember. So the WHO definition of drug is it is any substance or a product which is used or intended to be used to modify or explore. So what you want to modify or explore? The physiological systems or a pathological status so that the recipient, that means the patient will be benefited. The patient will be benefited. So these benefits can be either a therapeutic benefit or a diagnostic benefit. So drugs in simple terms, they are the chemical substances which affect living organisms and are used to diagnose or prevent or cure diseases by the clinicians. So one can remember drugs in simpler terms. So drugs are a chemical substances which affect, please remember, drugs are chemical substances which will going to affect the living organisms. So thereby the clinicians use such drugs to diagnose or to prevent or to cure the disease as well. So please remember, drug is a substance or a product which is used or intended to be used to modify the physiological status or the pathological status to benefit the patient either in terms of therapeutic benefit or the diagnostic benefit. So next let us see, so what is the role of the safe use of drugs. So why you want to use the drugs very safely? So the safe use of drugs needs the sound knowledge of their various aspects. So sound knowledge of what? Sound knowledge of various aspects of the drugs. So what are those various aspects which you need to know before prescribing any drug? So you need to know the mechanism of action of the drug, what is the dose required for that particular condition, what is the route of administration, whether it is oral, whether it is parenteral, whether it is topical, whether it is local. Likewise, you need to know what is the route of administration. And you also know the what is the particular or specific adverse drug effects which are mediated by such drugs, and also the toxicity as well as the drug interaction. So before using any drug, the safe use of drugs can be done if you know the sound knowledge of the particular drug. So what are those parameters you should know? Before prescribing, you should know the mechanism of action of drug. You should know the dose which is used in that condition. You should know the route of administration. You should know the adverse effect caused by the drug and also the toxic reactions, and also if there is any drug interaction with the other medications. So if you follow these and if you keep these in mind before prescribing any drug, you're going to have a safe use of drugs. So whenever we talk about pharmacology, so it starts from the medicinal or the organic chemist. So medicinal or the organic chemist will create a candidate molecule. So chemist will create or prepare a candidate molecule or a compound. Chemist candidate compound. So chemist will prepare a candidate molecule or a compound, which is also referred to as new chemical entity, NCE. So following that, the pharmacologist will going to test. What they will going to test? The pharmacological activity of that candid molecule. So how it will be tested? In vitro, in case of animals. So once the preclinical studies are then done, they'll be taken into clinical study where human beings will be involved. So finally, there will be discovery of the novel drug. So this is the whole step which takes place during the process of discovery of the new drug. So let us revise. The chemist will going to create a candid molecule or a compound which is also called as new chemical entity, that is NCE. Following that, pharmacologist will going to test its pharmacological activity through in vitro techniques, preclinical study followed by clinical studies in the human beings. So following that, if the drug is safer and if it is more efficacious, etc., then you have discovered a novel drugs. So why you want to discover such drugs? Mainly for therapeutic intervention, therapeutic benefit. So general pharmacology. Let us see what is general pharmacology is all about. So general pharmacology involves aspects of sources of drugs, route of administration of drugs, absorption of drugs and factors affecting them, distribution of the drugs, biotransformation, which involves the metabolism of the drug, excretion of the drug, and mechanism by which the drug will going to act with the receptors to produce its action, and also the toxicity of the drug as well as the drug interaction, followed by preclinical and clinical evaluation. So please remember, the general pharmacology involves these aspects. So which are those aspects? One, this deals with the sources of drugs, route of administration of drugs, absorption of drugs and its factor affecting them, distribution of a drug, biotransformation, which deals with the metabolism, which deals with mainly with the metabolism. Then the excretion of the drug, mechanism mediated by the drug. So drug will going to act on the receptor to produce its effect. Toxicity produced by the drug as well as the drug interaction, and also the preclinical and clinical evaluation. So to summarize, we talked about pharmacology. So the pharmacon means drug, logos means it is a science. Basically pharmacology means it is a study of drug. It is a scientific study of drug. So basically it deals with the chemical substances which will going to alter or modify the physiological or pathological status so that it will produce beneficial effect in the patients. It can be of therapeutic or the diagnostic benefits. Next, we saw about the example how the drug will going to act. We saw the example of paracetamol. We saw the example of penicillin. So paracetamol decreases fever by inhibiting the cyclooxygenase enzyme, whereas penicillin will be effective against certain infections or the bacterial infections by inhibiting the cell wall synthesis. So next we talked about WHO definition of a drug. So drug is nothing but a substance or a product which is used or intended to be used to modify or explore the physiological or pathological state. So to bring about the beneficial effects in the recipients in either therapeutic or the diagnostic benefits. So basically you need to see what drug will going to do and what are the effects of the drugs. So the safe use of the drugs can be done only if you know the things like mechanism of action, pharmacokinetic parameters, dose of the drug, route of administration of the drug, etc. And the mechanism of action, toxicity and drug interaction profile has to be known before prescribing any drug so that you can use the drug in a safer manner. So then we talked about the general pharmacology, which mainly involves the sources of drugs, and it mainly involves the absorption of the drug, route of administration of the drug, followed by ADME, that is the pharmacokinetic parameters like absorption, distribution, biotransformation, that is metabolism, and the excretion. And also we talked about under general pharmacology, you are going to see the toxicities, drug interaction, preclinical and the clinical evaluation. So this was about the general concept of the general pharmacology. If you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology topics. Thank you.